After writing The Spirit of Homeopathy and developing the concepts of delusion in homeopathy, somehow the question came to me, is there a difference between people who need plant remedies, who need mineral remedies, and those who need animal remedies? If our substances from which the drugs are derived come from these three kingdoms, is it possible that somewhere the remedies reflect the source from which they come? And because the sources are so different, there is a difference in the patients belonging to the three kingdoms. This was the subject of my research for many years afterwards. Having an extensive practice, I was able to test out my theory that plant remedy people would be much more sensitive and reactive. Animal remedy people would be much more competitive, and mineral remedy people would be much more structured and organized. This was just the beginning. I tested this out on patient after patient who had good results, and it worked. I expanded this idea much more and tried to understand these substances in more detail. The kingdom classification was born. On the other side, Hahnemann had divided the diseases into three miasms: the sora, the syphilis, and the psychosis. At first I had dismissed these ideas as not useful in practice. But then the question came, could we see patterns in disease? Could we see a pace and the depth of sora as different from psychosis, as different from syphilis? And were there only three miasms, or could there be more patterns available? I investigated this aspect and I found that states of being, such as we call diseases, can be divided not into 3 but into 10 categories. I introduced the concept of newer miasms. People had already spoken a bit about cancer and tubercular miasm in addition to the first 3 miasms. I added ringworm, malaria, typhoid, acute and leprous miasms to this list. This classification, this framework proved extremely useful in classifying patients and remedies, thus making it that much easier in our remedy selection. Thus, for the first time, homeopathy kind of graduated from symptom to system approach. This whole concept and idea and its utility I documented in the book called The Substance of Homeopathy. The Substance of Homeopathy, I believe, marks the first step in the systematization of homeopathy, something that would develop much more in the next couple of decades. And thus, if you want to start at the very beginning, at the foundation, I would suggest you start with the Substance of Homeopathy once you have gone through the Elements of Homeopathy by Dr. P. Sankaran, and then the Spirit of Homeopathy, which is my first step into homeopathic research.